In the era of declining reimbursement to urology practices, it is imperative that you keep in mind your costs of doing business. In this video, I'm going to discuss UroLift and NeoTract, what the makers of the UroLift system are doing to make sure that you are not shortchanged when providing this valuable service to your BPH patients. And for those of you who do not know me, my name is John Lin. I'm a urologist in Gilbert, Arizona, also your humble host of the Thriving Urology Practice Facebook group, where we crowdsource practice management solutions for everyone's benefit. If you are watching this live, I'd love to interact with you. Feel free to leave any comments in the comments box. And if you're watching this on replay, possibly on YouTube, I would love to hear from you as well. Let's get right into it. I recently had a meeting with the, manager of my urology consultant. And just as an aside, I will say that NeoTract is doing an extremely good job. They really set the bar on how to take care of urologists in implementing a new technology. I've been personally using the UroLift system since 2015. I have currently no financial relationship with the company, although I was a former faculty member and I remain a center of excellence. No financial, I'm not being paid to make this video. In any case, I met with my urology consultants manager recently, and he shared with me some of the recent changes that are upcoming and are being implemented. Some I cannot discuss in detail, but just keep in mind that there are these opportunities for you if you want to better serve your men with enlarged prostates using the UroLift system. Okay, first of all, there's something called in-kind marketing. In-kind marketing. What that means is Teleflex, the makers of the UroLift system, will help you reach your BPH patients and bring them into your practice to make sure that they are taken care of in a form of a mailer, possibly, to your BPH patients, and maybe sending them an IPSS score in a way for them to contact you. Of course, they may include a little blurb about the UroLift system, but you would be reaching out to your patients, capturing those patients who are on maybe medical therapy and have not had a TURP, have not had a prostate procedure done, to really preserve the function of his bladder by taking care of this enlarged prostate issue earlier and not later. And just as an aside, I create a lot of content on YouTube, and invariably I get these comments from patients that are being managed elsewhere. They will say that, oh, I've had a UroLift, I had a TURP or UroLift procedure done about a year ago, and I still have frequency, urgency, nocturia, getting up at night. Why is that happening? Well, unfortunately, I have to tell these patients, these men, that because you waited so long to take care of this enlarged prostate issue, your bladder may have suffered irreparable damage. And the key, I think, for us urologists is to intervene sooner than later so that the patient's bladder function is well preserved. Often, I also tell my patients preoperatively that your symptoms may persist for months, if not years, because so much of what you do and how you are avoiding is because of habit. You're now habituated. You're used to peeing all the time, looking for the bathroom all the time, going to the bathroom before you leave the home. As soon as you get to Home Depot, as soon as you get to Target, as soon as you get to Walmart, you're looking for the bathroom. It's become such a habit that you continue doing so. And my goal as a urologist, is to help make America pee again and preserve the function of the bladder of the patient. And one of the ways is through the UroLift system. So what you can do is reach out proactively to your patient database. Through your patient database, bring up a list of patients who have BPH, who are on medical therapy, and with the collaboration with NeoTract, you may want to send them a letter with an IPSS score and, hey, here's the link that you want to click on or call us so you can capture these patients and take care of them and try to cure them with either TURP, Resume, whole lap, aquablation, UroLift, however you want to take care of them. But that's called in-kind marketing. They're collaborating with you. NeoTract is collaborating with you to reach these patients, to take care of these patients, however you may want to take care of them. So that's called in-kind marketing. Another way to do this in-kind marketing is that you may want to consider giving live in-person presentations in your local market. For instance, I've done a ton of in-person presentations to local 55 and older communities. What I have personally found is that the attendance is not really that good when I give those presentations. What has worked in the past is reaching out to my patient database and get them to attend a Zoom or a virtual presentation on BPH. That way they can stay anonymous, they can attend without leaving the comfort of their homes. It's convenient for the patient. So you may want to consider either in-person presentation to patients or possibly doing a live webinar where you can interact, you can present and also interact with the attendees and answer their questions in real time. Another way to leverage this in-kind co-marketing is reaching out to your PCPs. And now I'm not just talking about the physicians only. I'm not just talking about MDs and DOs, but also APPs. They are, for a lot of them, they are the first person that patients see for their BPH symptoms. It may be the only person that the patient sees to manage BPH for him in the primary care setting. So you may want to send an invitation to your local APPs and PCPs to invite them to a dinner program where you can talk about BPH, talk about the various treatment options, not just UroLift, but this is a co-marketing opportunity to get your face in front of PCPs to take care of the over probably 40 million men in the US alone with BPH. So think about some of these in-kind co-marketing opportunities if you wish. And for those of you who are just starting a practice, or if you are really passionate like I am about BPH and taking care of men with BPH, these are some of the co-marketing opportunities that are out there that you may want to consider. Okay. Secondly, the in-office rebate for the use of UroLift implants will definitely continue until first quarter of 2024, meaning the $300 rebate will continue as it is existing and going on right now. Now, this rebate still pertains only to Medicare, Medicare replacement, also known as Medicare disadvantage plans. I call it disadvantage plans because they're disadvantage plans. Medicaid and TRICARE patients only. That first implant that you place you can get a $300 rebate if the payer is one of those that I listed every time you place one of these implants in these types of patients. So that is currently going on. If you're not using it, if you're not taking advantage of that, talk to your local urology consultant for UroLift. So that is going to continue. Make sure you take advantage of that. And it's going to continue on until Q1 2024 because, as you all know, the Medicare physician fee schedule will change. The final rule will come out in November, at the end of November, most likely, and be implemented in January 2024. So NeoTract will most likely continue on this rebate program beyond Q1 2024, but the reimbursement rate may change. So take advantage of it now and keep your eye out for future updates regarding reimbursement or rebate program. And the next couple of items I can't really discuss in detail. These are things that will help you defray the cost of these implants. As you know, these implants cost close to $1,000 for some of us. And if you are a large urology group, your cost per implant may be lower. And you're putting in 5, 6 of these implants in the typical patient with BPH. So the cost is extremely high and you can't afford to mess up one implant. But there are ways to grow your BPH business, UroLift business, by taking advantage of some of these programs that NeoTract is slowly rolling out in selective accounts, if you will. And I'm not going to go into detail of these accounts because it is not offered to everyone, so that this is something that you definitely want to talk to your urology consultant about. All right. Then number 3, a warranty program for replacement of implants should an untoward event happen during the implantation, meaning a bone strike or pull through. That is something that is available, especially in the surgery center settings. I know the number of implants is limited in the ASC hospital setting because it's a crazy reimbursement scheme that we have in the United States. If you put beyond more than 4 or 5 implants, the surgery center is literally losing money taking care of that patient. And if you have an implant that did not deploy for whatever reason, then there are ways to make sure that, number 1, you're not billing for that implant, and number 2, there's a possibility for NeoTract to help cover the loss of that implant, if you will, so that the surgery center is not losing money for taking care of that patient. So this is not a carte blanche warranty where for every implant that you mess up or did not fire, you're getting covered for it. So it's not a carte blanche replacement warranty policy. Again, talk to your urology consultant regarding this program. All right, number 4, this is a pilot program that is being rolled out by NeoTract. This is kind of exciting. As you know, the bane of your existence is not taking care of patients, but what you have to deal with when in the course of taking care of these patients. And if you're thinking about implementing UroLift or putting UroLift implants for BPH among your patients, often you're dealing with a third-party payer. And when I perform digital rectal exams on my BPH patients or elevated PSA patients, this is what I tell them. I'm going to have you bend over, put your elbows on the table. I'm going to do a rectal examination. And I tell these guys, this is the worst part of my job other than dealing with insurance companies. Yeah, that's exactly what I tell them. So as you know, you need often to jump through hoops and hurdles, artificial hurdles by the insurance company to get prior authorization to provide a medically necessary service to your patients. These prior authorizations take up a lot of time and resources for our practices. Your staff have to spend a lot of time on the phone, finding the right paperwork, filling out the paperwork, and then more importantly, following up after filing the paperwork. Well, NeoTract is rolling something out to help this prior auth process using a third party. So they'll contract with the third party that will help you with the prior auth headache and the pain in the butt to help mitigate that pain in the butt. Maybe rubbing a little bit of cream in that hemorrhoid to decrease the discomfort of having to jump through this prior authorization hoop. So again, talk to your urology consultant. This is a pilot program. I don't know if it's available to everyone. I don't know how it's going to be implemented, but they're using a third party to help with your prior authorizations. All right, so those are some of the programs that are available. And just like before, if you want to collaborate with NeoTract on marketing to capture more of these BPH patients, because there are not enough urologists in the US just to take care of BPH patients. If you want to accelerate that process, you may want to consider collaborating with NeoTract with Facebook advertising, with Google ads, and try to capture some of these patients to take care of their prostates and, more importantly, preserve their bladder function. All right. As always, if you have any comments, suggestions, agreements, and disagreements, please leave them below. I look forward to seeing everyone and interacting with everyone. Please take care of yourself, take care of each other, and I thank you for the privilege of your time. Bye-bye.